Eric Dishman is the general manager of Intel's Health Strategy and Solutions Group. This unit is recognized globally for driving healthcare reform through technology, with a specific focus on enabling independent living for seniors. I asked him to explain the relationship between Intel's healthcare system and the big data.
Intel sort of is the powerhouse for a lot of the computing that helps us make decisions about care every single day, right? Our computing technologies are inside electronic health records, they're inside medical equipment, they're inside the tablets that doctors and nurses are carrying around and the smartphones. So in some ways, the technologies that we bring to life power a lot of what's going on in healthcare.
Can you share with us a little bit more about the big data, the healthcare systems, how that enhances or affects the healthcare systems that you're working on?
We call it big data because if you think about it, a once-in-a-year blood pressure, that's not a big bit of information in a computer. You start to collect your blood pressure several times a day, or your smartphone ultimately may have sensors in it that collect your blood pressure automatically. Suddenly, you're generating volumes of data at a high velocity over a long period of time. You need algorithms to make sense of all that. Your doctor or your daughter don't want an email every time your blood pressure changes. You want algorithms to make sense of all that data. Well, what Intel's enabling in this case is everything from the silicon, the chips that go into all these computers that allow that processing to occur and allow that data sharing to go back and forth, the storage that can store all that data, because suddenly there's this explosion of data in healthcare because you're just collecting so much more data, and a lot of it's going to be things like imaging. I mean, it's even possible soon to be able to do an ultrasound on your cell phone. So instead of ultrasound being a once-a-year thing that might be done for somebody when they're pregnant or when they have a particular illness, in theory, you could start to collect ultrasound data all the time. It creates enormous demands for storage. And then you've got to have security so that you trust all that data getting from point A to point B. All of these are aspects that Intel's working on to try to make big data and healthcare real so that personalized medicine for all of us can be real.
How close are we to this being a very, very big game-changing event, not just in technology, but for the healthcare world?
Healthcare is finally going digital. It's about the last industry to do so. And once it does, we're making all these kinds of discoveries about things we never knew. And there's new kind of data types emerging, like genomics, right? If you today were lucky enough to be one of the 50,000 people on the planet who have had their whole genome sequenced, it generates somewhere between a 3 and 5 terabyte file. That's like 3 to 5 of the biggest hard drives that would be sitting in a desktop or laptop computer today. That's just one genome sequence at one point in time. And what's the magic of that genome sequence? Well, today, clinicians are starting to use it to be able to customize cancer care and specific drugs to you because they know how your body is going to respond to those drugs. So the difference here is we're no longer doing months or sometimes years of trial and error on you as an individual. We're taking your whole clinical data, your genome data, and consumer-generated data that will come from your home and smartphones and telehealth devices, and making sense of all that data to customize care to you as an individual level.
Some hospitals are going to embrace it fully, and some might be a little bit more skeptical, and they might be concerned about the costs. Tell us about the reaction that you've seen from different hospitals and the medical community around the world.
If you think about healthcare today, all around the world, mature markets and emerging markets, it's a reactive paradigm, meaning we wait until somebody's enormously sick, and then they get whatever care they can, whether it's from a village elder who doesn't know very much about helping them, or it's an expert oncologist, and we pay an enormous amount of money to put people back together again once they're already broken or sick. The vast majority of the world's healthcare costs are chronic diseases that can be dealt with and prevented in most cases if you have data and you feed it back to the patients themselves and the people that are caring for the patients.